So we did our project on gender reassignment, and my name is Andrea Perez.
My name is Hira Laren.
My name's Yamal Naya.
My name's Kimberly Garcia.
This is a video that Kimberly and Andrea started. They went around the school and recording people and their reaction to gender reassignment.
Miss Laren, how do you feel about gender reassignment?
I feel like people should be able to match the bodies that they feel like they are in.
Okay, what do you know about gender reassignment?
I know that it is when a person chooses to change their gender based on how they feel on the inside. Like maybe there's a female, but on the inside she feels that she is meant or he was meant to be a male. To me, I don't really have like an opinion on it. I think it's whatever you choose to do is it's kind of like your own decision. I have a lot of friends actually. I went to an all-girls school, so I have quite a few friends who did that. Like after college, they decided to change their gender. So I think it's all about how you feel. Like whatever makes you happy. Like I don't judge you.
Thank you. So I just wanted to ask you guys, how do you feel about gender reassignment, and what are your opinions? So we'll just go down the line.
I think it's whoever wants to be a girl or a boy, either one. It's their choice. I don't really judge people for what they want. Like, you know how most religions are extreme?
Yeah.
And they say that's wrong? And that they say they're demon-filled and stuff like that? I'm the opposite of that. I think they have the independence to do what they want.
I don't really judge them. I just think you are who you are. And if you're not who you are on the outside, you should change it and make yourself feel however you want to feel.
Yeah, I feel the same way. Yeah, you are who you are. Like, if you're born a girl, like, or with the mentality of a female, then you deserve to be a female. Like, no one should take that right away from you. Everybody has a right to do that, so.
Thanks, guys.
And now we're going to go a little bit more into depth about what gender reassignment is. And so gender reassignment consists of genital reconstruction and facial reconstruction in order to match people's feelings of who they feel they are. It's also, they're identified as transgender. A good example is a person famously known as Bruce Jenner, an Olympian, who for a long time has felt like he was a woman and therefore changed his gender to a woman and is now recognized as Caitlyn Jenner.
So, analysis of health problems. Why would you need this procedure? What health problems does it solve or prevent? Anybody who does not feel comfortable physically or emotionally, whether it be male or female, would want this procedure. What would happen if you need this procedure and you didn't have access to it? For starters, the procedure is about $75,000 to turn male and $40,000 to turn female, so it's pretty pricey. But for those who cannot afford it, Medicare just lifted a 33-year ban on coverage for gender reassignment surgery after they had a lawsuit filed. Who usually gets this procedure done? Is there a specific group that it is more common in? It's more common in the LGBTQ community, millennials, and adolescents. They're the most common groups to get gender reassignment surgery. So, is it a diagnostic procedure, meaning preventative, or is it used to fix a problem or cure a disease? It's not a preventative procedure, and it doesn't cure a disease, but it's just a procedure to change a person's sex because they don't like the way they are right now, or they don't identify as what they are right now.
So a lot of people question, where can I get this procedure done? And this is a very serious medical procedure, surgical procedure that is done at hospitals. And what is a doctor that you can consult? Well, a plastic or reconstructive surgeon is a good way to go. And another question, significantly, those surgeons that are specialized in gender confirmation surgery or sex reassignment surgery will do the best jobs because that's their specialty. And what equipment will be needed? Well, it really just depends, because if you're a man looking to turn into a woman, you might want to consult chest augmentation. Whereas if you're a woman looking to go into a man, that might not be necessary, and you're going to want jaw sharpening or facial hair, so it really does depend on what route you're trying to go to.
So you might be asking yourself, what do you need to do in order to get the surgery, and what do you need to do before? So you need to make sure that you identify with the gender that you are trying to change into. So either of the two sexes. You're going to need a consultation with a doctor so that you can know what you need to do or what will be needed. You also need to make sure that you have thought about this and that this is what you want to undergo, and you need to be emotionally aware of everything that is going to change after. You also need to quit smoking a few weeks prior to surgery because nicotine only slows down the recovery. You also need to make sure that you have 2 referral letters from qualified professionals so that you know that you are okay for the surgery. You also need to be 18 years or older. You need 12 months of continuous hormone therapy, 12 months of living in that gender role that you're going to identify with, just so that you personally know what you're going to be changing. And so some risks of this procedure and some outcomes will be suicide because of all the hormone changes and all the changes that are going to be coming your way because of comments or hatred. And patients are usually also found to be less gender dysphoric, and you are going to have less anxiety levels and depression levels because you have changed into the person that you have always known to become. And so what does it feel to get the surgery done? It is a life-changing experience, and it cannot be reversed, but it is also the last step in your physical transformation. So an experience that I quoted was that this surgery is very painful, it's scary, but it is also very expensive, and it comes with a year of recovery, which is just something you have to take into consideration if you want to have the surgery.
There are many things a patient can do to make the procedure easier. One thing they can do is understand that expectations may never be met, and even after many surgeries and many other procedures, one may never be completely happy with what happens. But you should always expect full-time care. This should be full-time care for at least 2 weeks post-surgery. This is from The Guardian. And you should also make sure you have family to help you after the clinical process, and so that the social process can begin. And lastly, you should be as specific to your doctor about what you want and what you don't want to make things easier for the doctor as well. This procedure definitely helps people become better as a person if the procedure goes as well as they want. With that, there's no medicine or cure to help somebody. There's just a procedure and a surgical procedure that can happen because one of the reasons is because it's not a superficial procedure. It's very invasive, and it goes into your face. It can go into your genitalia, and also it's not superficial because it's a deeper desire within people. For one, there is for instance, one specific person had the desire to change identities for 50 years, and this is from the Gender Network. For them, this community of people changing genders is like a medicine, and it will ease a lot of the internal problems they have. Karen, who's 52, said that after going through the procedure, she felt delighted with the outcome of her surgery. From the Telegraph. If you ever wanted to talk to your parents about this, and this is something you should do, definitely you should tell your parents because they'll give you some insight on how to do it. You should always be calm and assertive because you never know how your parents will come off. They might be negative and not want you to do it and tell you not to do things like this, or they might be supportive. Either way, you should always understand that there might be some problems. You should be comfortable with who you are and be comfortable with the changes. For example, there was a mother who said that her young girl would cry every night saying that she was a boy in the wrong body, and from the Telegraph, and this is common for some kids. This is a video on a life experience from one young girl who went through the same similar problems.
When I was younger, I realized there was something different about me. I didn't really like playing with Barbie dolls or wearing dresses. I preferred hanging around the boys and playing with action figures and cars and playing in the mud and even playing with the insects sometimes and frogs. Not that many people liked me. I got picked on. It made me very sad. When I started to hit puberty, that's when it got hard. I felt fat and ugly, and I got bullied for being the tomboy. But I knew there was something more to me, something that was missing. I didn't know who I was. But then I got a phone one day and discovered the term transgender. And I looked it up, and it made so much more sense to me. I realized that I was transgender. I didn't tell anyone until grade 8. I was too scared to come out because I thought people wouldn't like me. But surprisingly, no one really hated me for it. I had so many friends who cared and tried their best to understand. But sadly, some people didn't. But that's okay. It's hard to understand. Now I'm very happy with who I am. And I'm proud to be myself.
Oh my god, and we totally jumped off the cliff and had to swim all the way to shore because the...
And that's our presentation on gender reassignment.
If you have any questions, feel free to come up to either me, Jairo, Kim, or Andrea, and we'll try our best to answer them.
Thank you.